Hi, my name is Komal Farooq, and today I'm going to discuss some common problems related to your spine, cervical spine mainly. And sometimes what happens, you feel the pain in your left arm, for example, and you start panicking, like, oh, maybe it's coming from my heart, or maybe I'm having a heart attack, and then you start panicking. Then you went to go to A&E, and you have ECGs multiple times, but it shows normal reports, normal findings. So for this reason, I made that video just to have you a better understanding of your problem. And the common problem is cervical radiculopathy, and it's coming from your spine. So first of all, I will give you a better understanding of your spine. So there is the normal anatomy of your spine, and here you can see you have vertebrae, you have bluish thing, grayish thing, the discs, and you have spinal nerves which are going through every disc and every spine. Okay, so what happens? They should be adjusted at specific height. The one thing you have to notice that each spine is separated by the disc and they are adjusted at specific height. So with the passage of time, as you grow older, the fluid inside the disc, they start getting deteriorate, it start getting less, and you feel dehydrated in your discs. So that's the one thing you have to be careful with as you age. So when the discs, they start losing their fluid, and then the bones, the vertebrae, they start coming closer to each other, and they start pinching the nerves, putting pressure over the nerve. In some cases it might damage the nerve, and it might block its conduction. So you have to find out some symptoms in your hands, in your arms. Like, you have to find out the symptoms so that you know that whether it's coming from your neck or actually it's coming from your other organs. So first of all, you have to find out if there is any numbness, pins and needles, either in one arm, one hand, or in the other arm, other hand. So you have to be aware of that thing. If you are feeling like your arm is getting weaker, or it's pins and needles, numbness all the time, so you have to look for these symptoms. And also the sharp shooting pain which is coming from your neck and going down to your arm and hand. And sometimes what happen, like the pain, it's going towards your head as well, like you feel headaches, migraines. It can be the cause of the nerve impingement. So you have to look for that one as well. And you can see, like, also another thing is the curvature of the spine. Some people have too much curve, the spine, and that also start putting pressure on their nerves. Also, you have to notice which pillow you're using, either too high, either too low, either too soft, too hard. So you have to be careful while selecting the pillow. It should be, while you're sleeping, your head should be, your spine, cervical spine should be properly aligned with the rest of your spine. So there are many these things you have to look for. And it acts like this, like you're having pressure, like the nerve is pinched, and it's going at the back of your spine, like a shoulder blade, and then the arm, and going down to your fingers. So you can see sometimes it goes on both sides. It start trapping when the fluid in the disc is very reduced. It start trapping the nerves on both sides. You start feeling tingling on both sides. These all are the illustrations of cervical spine. So in this case, what physio do in this case? We try to distract the head from the body, so that we can release the nerve which is impinged. So what we do, we just pull the head away from the body. It's kind of traction. So it helps. That's the one thing we do as a physio. And also we try to manipulate just to release. These are all the different ways we use just to release that nerve which is causing the problem. This is the main thing which I wanted to share with you as a good tip, home remedy, and that's the cervical traction collar. That helps you to, that gives you the traction. It pulls the head away from your body so that the nerves, they are at specific height. They release the pressure over the nerve. The nerve start healing. The nerve which was already pinched is start healing, and then you take off all of the pressure from the nerve, and then it start healing and it gets better slowly. But that's not the only case. In case any one of you is going through this type of a problem, like a cervical radiculopathy, or if someone is struggling with the nerve and all these things, I will highly recommend to consult a physio just to make sure you're not damaging your nerve in that area. And you should have a proper treatment for that one, because it can lead to nerve damage in that arm that can lead you to the serious complications in the end. So be aware of your problems. And one thing, if you have sharp shooting pain, for example, when you slept and you woke up and you are in terrible pain because of you don't know how you slept, and maybe you pinched your nerve while sleeping. So the first thing you have to do is to apply ice as much as you can, from 20 to 30 minutes a day, just to relieve the soreness and inflammation in your spine. That's the one thing you have to do. And you can have that the device just to correct your posture, just to relieve the hump at the back of your neck. This can help you. But how to use it and how frequently you should use it, and how to treat the problems you already have in your neck, I must recommend you to have a physio session. Most of the people, they don't know what physio do and how they help. So I just wanted to give you public awareness. If you are struggling to all these type of issues, you should consult any physio, so that they can give you the proper guideline how to correct your posture, how to work on it, so that can change your quality of life. So I am trying my best so that I can help you, any one of you who don't know what they are going through, the people who can't afford the physio, or the people who don't know where to go, whom to consult, and the people who really don't know what's going on with them, like why they are getting the aches and pains. And I just wanted to give you the awareness about all these problems. So you can do the home remedies. As I said, icing is the best thing which you can do at home. It's better than a paracetamol or ibuprofen. It can give you quick and long lasting relief compared to compared to paracetamol or ibuprofen. So I hope that this video helped you, and I will keep posting the videos so that you can get awareness. So I will try to make videos on every part of the body, like joints, knee joints especially, and ankle. And also one more thing I wanted to recommend you in terms of your most people must be wondering like what they should do to keep their discs hydrated. So the first thing which I always recommend to my clients is the fish oil, omega-3 fatty acid. That's the very important supplement. It gives you should have a lubricant in your body, in your joints, just to keep your joints, to protect them from arthritis or any kind of wear and tear, degenerative changes in your joints. So I will recommend you to have a fish oil, omega-3, and start using it in your diet, so that this will lubricate your all of the joints in your body. So that can help you with the knee pain, ankle pain, lower back pain, shoulder joint pains, everywhere. So it will also keep your disc hydrated, and also eat a lot of fish. Thank you.